Hello and welcome. This morning, I'm Charlene Castle, National Director of Epilepsy South Africa. Today, we're going to talk about the South African Intersectoral National Action Plan for persons with epilepsy and other neurological disorders. I'll refer to this plan as SAINAP through the presentation, but let me start introducing you to our wonderful organization. We are dedicated to working with people with epilepsy and other disabilities, as well as helping families to lead meaningful lives and to know how to look after and care for their loved ones with epilepsy or neurological disorder. We focus on creating opportunities for people with epilepsy to be fully participating members of society. Established in 1967, we're almost 60 years old, and we are the sole national organization in South Africa serving persons with epilepsy. Our mission is for people with epilepsy and those affected by it. Our mission is to promote the rights of persons with epilepsy. And our vision is to see a world where people with epilepsy are included and accepted without discrimination. Let me start at the beginning, the IGAP, as we've come to know it, the Intersectoral Global Action Plan for epilepsy and other neurological disorders. It's been the genesis of a 10-year journey. In May 2015, in the World Health Assembly, they adopted a resolution that was focused on the global burden of epilepsy. In November 2020, they expanded the target group of the previous resolution to include other neurological disorders, and they called for the development of a 10-year roadmap. A moment in history was that in May 2022, in the World Health Assembly, with all the member states present, there was a unanimous agreement to adopt the Intersectoral Global Action Plan for persons with epilepsy and other neurological disorders. A step and a plan and an approval that the international epilepsy community had been asking for many, many, many years. So, what is the vision of the IGAP? It's where brain health is valued, protected, and promoted, where the neurological disorders can be prevented, diagnosed, and treatment, and premature mortality and morbidity are avoided. People affected by neurological disorders and their carers, for the first time ever, the carers are mentioned in such a strategic document, can attain the highest level of healthcare with equal rights, autonomy, and respect. Now, what is the goal of IGAP? The goal of IGAP is one, to reduce stigma and educate citizens and to create awareness, education, and understanding of epilepsy. It calls to improve the life of people with neurological disorders, their carers, and their families. It calls to strengthen the prevention, treatment, and care. And the last goal is to ensure that it's a holistic approach. This is not just a medical model. This is a psychosocial, economical, medical, as well as individual model. And we have to remember that. What has Epilepsy South Africa's journey been to get to the point where we are now? And I'll tell you where that point is shortly. In 2022, we started at the beginning and we embarked on a national survey asking individuals how much of the IGAP is relevant to South Africa and what is pertinent to us. In 2023, with these results in hand, we decided to go on a 9-province road trip. And we took these questions to a greater audience, to the people of South Africa. And we presented and did focus groups in all 9 provinces for hundreds of people. Out of that and all the feedback started the journey of collating the draft plan to be submitted. And during this phase in 2023, We sat back as Epilepsy South Africa and said, how do we take this detailed document that World Health Organization has approved and make it available and understandable and easier for you to understand and grasp and understand what it means to you? Now, we then had to consult various stakeholders through this process because, as you know by now, it's an intersectoral national action plan, meaning there are multiple stakeholders that will be needed to do the full implementation. We had an accessibility, inclusive stakeholder accessibility workshop with all the government departments present in 2025. In 2024, we gathered civil society, academia, advocates, and the like to look at the draft plan. During the course of 2024, the draft plan had actually been submitted already to the Department of Women, Youth, and Persons with Disabilities. And it came back to civil society to say, give us a draft that as government we can then work to approve. We collated, we worked together in collaboration, and we then continued this journey. In 2025, as I mentioned, we had a forum where all the government departments joined us with representation from them. We worked, shopped SAINAP again. We looked at the goals, we looked at those outcomes, the metrics, and what we needed to achieve and who needed to do what. And that document was then circulated through government for comment. And there was a period of time it was given and it was closed. The reason it needed to be closed is because that document had been 5 years in the making and it wasn't time to start or add new information. Consultation had been done with over 1,000 people. We had a document now and have a document ready and waiting to be approved in cabinet. During 2025, World Health Organization arranged 2 workshops in South Africa because we've been acknowledged as leading the road and being the leaders in taking the IGAP into a country. And this year, 2026, is seeing a rollout of a WHO campaign calling for implementation of certain projects within the campaign. One of them being webinars. One of them was a workshop with all the provinces in South Africa coming together to develop their own plans for their province for implementation. Remember again, it's intersectoral. So Department of Social Development is part of it. Department of Health, WITS, Epilepsy SA, and the other civil society organizations from the task force, and the DWYPD, the Department for Women, Youth, and Persons with Disabilities, that sits in the President's office. We had everybody in the room. The working group with all the stakeholders was formed in 2025. Another big step for us. And this is where the agenda for implementation and approval is ongoingly driven to ensure that this is achieved. To give you an overview of the civil society task force, is that Epilepsy South Africa is the chair of the task force, and it's the first time ever that all the neurological disorder organizations that are listed in the IGAP came together and worked together on the task force. This is incredibly powerful because it enables the working group, the inclusive stakeholder working group, the government working group, to know that civil society has spoken with one voice to get to SAINAP. So what is this document? So let me show you a high-level view of it. Number one, the comprehensive national response. SAINAP is rooted in the global standards of IGAP. It's a holistic and integrated approach. I've said that before, it targets multiple stakeholders. SAINAP covers the full spectrum of care, from awareness to prevention of treatment to rehabilitation and support services. It's person-centered focus. And we understand in SAINAP that it requires a comprehensive response, incorporating healthcare, social services, education, and community. SAINAP calls for equity and accessibility, so it prioritizes the inequalities. Social inclusion beyond healthcare. SAINAP promotes access to education, employment, and social protection for persons with epilepsy and other neurological disorders. Global alignment. What is really important here is that SAINAP has integrated the preventative and promotive healthcare strategies, and this contributes to South Africa's commitment to the universal health coverage and sustainable development. It's a collaborative implementation, so it absolutely calls for coordinated efforts. So what is the purpose, goals, and targets of SAINAP? SAINAP has created a framework for implementation of the IGAP and responds to the identified needs of South Africans, as we have heard. It's established a roadmap for implementation. There's 5 strategic objectives of SAINAP. The first being raising policy prioritization and strengthening governance. What is the goal? To establish these policies, plans, and legislation to implement. What does that actually mean? It means SAINAP needs to be adopted in cabinet. It means that epilepsy and neurological disorders needs to be included in the new Disability Act in South Africa. It means that SAINAP and all elements of it is implemented within South Africa. The second pillar is to provide effective, timely, and responsive diagnosis, treatment, and care. So the goal is access to medication, diagnostics, and other products essential for persons with epilepsy and other neurological disorders. Goal 3 is to develop the care pathways. We know the traditional healers is a step, the clinics is a step, the hospital is a step, the discharge is a step, the carers throughout. So we need to understand in depth what those pathways actually look like. I mentioned earlier, it's the first time in any international document where carers are mentioned. So we need, as a goal, to give those carers the support and education that they need. And goal 5 is to promote awareness and educate all those citizens in South Africa about epilepsy and other neurological disorders. Our third pillar is to implement the strategies for brain health and prevention of neurological disorders. This talks into the most beautiful and important topic, healthy lifestyles. The details around there are deep and broad, with many individuals again involved, from nutritionists to exercise individuals to coaches. So it's creating a whole ecosystem where we know sleep, emotional stability, eating habits, exercise habits are critical to controlling seizures and adding longevity to lifespan. The fourth pillar is strengthening the public health approach to epilepsy. And what are we looking for here? That epilepsy and persons with epilepsy have access to epilepsy services. The fifth one can never be undermined, and it's research. Information and research papers on epilepsy and neurological disorders in South Africa is thin. And our purpose there is to ensure that there's relevant and important information given to all in South Africa. So what is SAINAP? SAINAP stands as a transformative roadmap for equitable neurological healthcare in South Africa, ensuring that nobody gets left behind. So please come on our journey with us. You will understand more and more in time of what SAINAP actually means to you as an individual person. Just one small part is access to healthcare, understanding the care pathways and having access to significant amounts of information. That's a powerful document, a document that many stakeholders have committed to already and will commit to in future. So thank you for the time today. I hope I've shared and added value and done justice to this very exceptional document that's been written and submitted for approval. Thank you once again, and take care.